now Dr. TSay. Now we're going to go to your patient here.
Okay, so the left is obviously the before, and this is a early 40s Caucasian female. At this point, I've already done some fillers. I've already done a little bit of Voluma, a little bit of some Juvederm, a little bit of Sculptra, and she was kind of still looking tired and wanted to improve. Mainly was kind of like the sagging issue. So, Sheena, what kind of comments would you think that I possibly did on her?
So definitely, I think that trying to improve a little bit more the mid-face volume may help. Well, I don't know if that's what you did for the after picture, but it looks like her volume is much more natural. She looks a lot more useful, especially I like what you did around the perioral area. It looks much more improved, pre-gel sulcus, all this stuff. So I'm thinking, and the quality of the skin looks a lot better, so I'm not sure if you did any light device or energy device to improve the quality of the skin, or of this if the effect of Sculptra. But overall, I think that was a great improvement on the mid-volume face. The shape of the face is more oval. To me, the best thing is what you did to the lower third of the face. I think it looks so much more useful and natural.
Dr. Kassir, being a surgeon, would you comment on this, and if you would offer her even a surgical option?
If that was a surgical result, I'd commend you on that too. So the fact that you did that non-surgically was pretty impressive. I agree with what Dr. Shino-Bay said. The lower third, you've done an excellent job. The philtrum to me looks, instead of built in where that line is really a crevice, it's flattened out a little bit and it looks much more aesthetic. The mental crease looks better. The marionette lines look better. The jowls look better. And two areas that I see that look really, really good are the lower lid mid-face junction, especially on the right side, that's pulling away and almost looks like a festoon. I don't know how you corrected that, but it looks like volume and you did a nice job. I see she has platysmal bands on the left and none after, so you've either done neuromodulator or used some serious energy device to smooth that out. So again, whatever you did, very nice job.
Doctor, could you comment on what you would, how you would approach this patient?
Well, I think she got phenomenal results. She definitely looks much, much more improved. As Dr. Kassir said, the philtrum looks much more natural and her lips look better. The pre-gel sulcus definitely has been volumized, and in that area I would have used fillers. I basically tend to use either Sculptra or Radius in that area because it's just a much more robust filler for the jawline and chin augmentation. As far as the tear trough and under eye and where you have that malar defect that some people do get, it looks like you may have used a particular filler underneath. The first thing though that I would have done, and maybe you have done, is before even volumizing contouring, is my go-to is usually doing some radiofrequency microneedling high energy device for skin tightening for pores, used along with combination of PRP for the quality of the skin. If the patient needs laser resurfacing, then at that point I go ahead and do that. As far as any kind of lifting and volumizing, I will do that with the fillers, and I also do adjunctive therapy with the PDO threads in conjunction with that to get similar results.
Excellent. Yeah, at the time I didn't have the RF microneedling, but that's a great comment and great option. So again, it is combination therapy, and I you know, in the before picture, I already maxed out, and she didn't want to continue stuffing more fillers, and so I gave her the option of threads. So what I did was, it's a very simple solution. I used the Mint PDO threads, which are the barbed threads, 43 centimeters, attacked it with a stitch into the temporal fascia, and tunneled it down to the lower third of the face, 2 on per side, and did basically a thread lift on her, which I didn't even address specifically the neck. That wasn't even toxins, that was just the result of the lift.
Great.